Sabina. So Sabina is a strategy and policy senior manager at the NHS. She has been working in health and care for around 2 decades, and that includes working at the Care Quality Commission for 15 years and a year at NHS Confederation as senior policy advisor. She is also co-chair and co-founder of the NHS Muslim Women's Network. And today she'll be talking about the network and some of the work the organisation has done for Muslim women in healthcare. So without further ado, I'll pass on to Sabina. I will stop sharing my screen and I will pass on the control to you.
Thank you. And hopefully it works. We did test it out kind of earlier on. Not used to Google Meets, but hopefully that all works. Yeah, can you just check in? You can see my screen?
Yeah.
Yep, great. Assalamu alaikum. Thank you for the introduction and thank you for inviting me to come and speak at this webinar and to your members as well. It's a real privilege to be able to kind of speak, especially with all the great work that BIMA do. As was mentioned, my name is Sabina Hafesji. I'm co-founder and chair of the NHS Muslim Women's Network. And it's great to see, I can see at least one of our members on the call as well. But if there's any other members of the network, please kind of share in the chat that you're here as well. It'd be great to kind of see that as well if you want to share, of course. As mentioned, I'll be speaking about the challenges in the workplace, and what I've tried to do is basically most of my kind of session on what our members have said. So I've reached out to our members and really trying to reflect what their feedback has been. I'll just start off a bit, first of all, just talking about our network. It's not a massive network, and we've probably got around 100, around 300 to 400 members. We were set up at the start of the pandemic, where the other co-founder Sajda Ahmed and chair who stepped down earlier this year, we connected virtually as you tend to do. We started talking about kind of work stuff, and then that kind of translated to talking about some of the challenges that Muslim women face in the workplace, working especially in health and care and the NHS. And what kind of developed from that was the network, which is nearly 4 to 5 years running, alhamdulillah, with hundreds of members and across England, but we do have members across the other nations as well, and from a range of disciplines. So we have students to radiographers to GPs to mental health nurses and policy professionals, and like me, lots of nurses and midwives and people working in mental health as well. We really kind of part of our network is really raising awareness on, as I said, the challenges that members face, but we also want to kind of celebrate our achievements as well. I think it's really important to do that, especially when you find in this space, not everyone does that. So we try to kind of really share, our members and what they do. We've had members who've won the HSJ kind of awards kind of for their work that they do, or be on a BME list of influential members. One of our members won the Midwife of the Year award from Nursing Times, where he did a bar. So, again, really try to showcase some of the great achievements. We've worked with lots of organisations like BIMA and other networks as well, but also other organisations like NHS Confederation and others as well, to kind of really talk about some of the challenges. So we held a private roundtable with senior leaders in the NHS to really talk about the lived experience, and our members were part of that to talk about kind of really hard-hitting lived experience as well. We also have contributed to the national kind of uniform consultation and contributed to reports, for example, MDA have done in terms of racism and Islamophobia in NHS as well. And last year, along with BIMA and UPNA NHS, we worked with NHS employers to talk about how employers can support their staff during Ramadan as well. And that was recorded, and happy to kind of share that if that's helpful as well. We have 4 main objectives of our network, and these were developed with our members. So we always talk about our network being for our members. And one of the kind of biggest things that we do is have that safe space. So we have a really active WhatsApp group. You don't need to kind of be joined by WhatsApp, but 2/3 of our members are on that WhatsApp group and can get quite kind of busy at times as well. But I think what we found is really important to have that safe space, and having that kind of space for Muslim women to kind of get together, especially as you might be the only visibly Muslim woman in your trust and you don't have anyone to talk to, and you've got some of these challenges, you've got an HR issue, and what people will do is just kind of check in and talk about some of the issues, and there'll always be someone to kind of give really good advice as well. We try to kind of have events where we can kind of aid professional development. We've got people who kind of might have an interview, for an example, and they'll kind of put a call out and say, I've got an interview, can someone help and share and then there'll always be a volunteer as well. We've piloted a coaching scheme as well, but we'd love to kind of do that and upscale that even more, because that's one of the areas that our members have said that they really would like support in. Just beyond kind of our women in the workplace, we also try to think about what we can do to reduce inequalities for Muslim women as a whole. So whether you're working in healthcare or not, and an example of this is that we're going to be working with the London region of NHS England to kind of do a webinar in January around screening and vaccination. So again, see what we can do to kind of improve the lived experience of Muslim women kind of beyond healthcare as well. And then, as I've mentioned, trying to do our bit in terms of influencing policy and system development, like the national uniform consultation as well. Just wanted to share a snapshot of our members, and I really love this because it really shows hopefully the kind of diversity in the range, and there's probably a few people on here that are members of BIMA Women as well, but I love showing this just to kind of show, like I said, to showcase the diversity, and we have lots of women. Like I said, this is just a snapshot of the women that we have, but I think really proud, you know, people like Nazreen who's here as well, to be proud of our network as well. So I just wanted to kind of put this up quickly. And then just to kind of talk about some of the achievements, we were really lucky to be nominated, Sajida and I, a few years ago for the Hafesji influential BME list as well. And that was an ally who put us forward. So it was really nice to have that kind of achievement. We've spoken at kind of various events as well. So for example, for International Women's Day, when NHS Confederation, NHS England had an event, we were asked to speak, which was a real privilege, and we spoke straight after Amanda Pritchard, which was quite interesting to be kind of a, you know, big shoes to fill after that. But again, really raising awareness of the network and the work that the network does. We really like to do things on Muslim Women's Day, which is on the 27th of March every year, and have had kind of events. And I think at one point when we did a tweet chat as well, we were trending, which is amazing as well. And then, like I said, we like to hopefully contribute to kind of other reports, other letters, other things that networks are doing to kind of really kind of work together collaboratively with other networks as well. So moving on to kind of the main crux of the presentation now. I will also add at the end, we'd love to have, you know, if you work in health and care and want to be part of NHS Muslim Women's Network, you're more than welcome to join, but I'll share some of the detail at the end as well. You know, you could be a member of more than one network, which is great. So moving on to the research, I don't think any of this is going to be a surprise for anyone on this call, but just some of the reports that have come out over the past few years. So the Muslim Doctors Association have done a report around a triple penalty about, you know, being Muslim and being from a BME background, and then for us as women, kind of that intersectionality point and that triple compounding effect that it has of kind of, you know, some of the issues that it raised and what that means for us. You know, we know about the medical workforce, probably around 10% are Muslim, and then even fewer, I think the research said 2 to 3% are in leadership positions, and what challenges that bring as well. You know, lots of Muslim women are in the labour market, so are actively contributing to the economy, but their experiences has been really, really difficult. One of the reports that we found talked about 47% of women stated that they've had discrimination, Islamophobia as a result of, you know, due to challenges in the workplace as well. We know that there's just not enough options in terms of training, mentoring, promotions. That career progression is really, really limited for women as well. And there was a report by the Runnymede Trust, which was published, I think, just a few weeks ago, which talks about in the NHS, Muslim staff are referred to prevent 8 times more than non-Muslims. So that is such a, you know, a big significant number to have to think about. And then microaggressions. This was some research conducted by the co-founder Sajida Ahmed, and just some of the examples. And you know, if I was to ask you all on the call, have you had any of these said to you before? Have you heard it? You know, asking whether you wash your hair kind of under, you know, do you actually have hair under? Do you even show like your parents? And, you know, do you wear it at home? Especially when you're working from home on screen as well, people do get a bit confused about that as well. I've spoken at microaggression sessions and often talk about that. Where are you from? Where are you really from? And people really pressing that. I'm more than happy to share kind of where I'm from, but probably not when I'm first meeting you. So yeah, just have a bit, you know, these are not going to be any surprises, I think, people, you know, but just some examples that I just wanted to share. Microaggressions, some people would say actually this is racism. You know, I'll be calling it microaggressions. You know, And it's that kind of saying about death by 1,000 cuts. If you've heard it once, then okay, if you're constantly getting it, it's going to have such an impact on someone's mental well-being. And then just some other quotes from some research that was undertaken by Sajida about kind of just what you hear, and just a kind of lack of kind of support as well. Kind of people not wanting to raise kind of any problems because it can concerns because they just want to kind of get on with their day job and don't want to think about it too much. Some of the things that probably the youngsters call it gaslighting, when you think you're paranoid about some of that, that kind of assumptions that oh, you speak really good English, I was born here, thank you very much. Having a room to pray in and being really appreciative and really grateful about some of that as well. It is easier now, people are hybrid working, but that's working from home, that's not always the case. But trying to find spaces. In one of my previous workplaces, when I joined, they offered me the stationery cupboard and said that's a space and you can pray there. And they were really proud of themselves because what they gave me was some laminated sheets to stick at the front of the door to say, when you're in there, use that so nobody comes in. That probably made it a bit more humiliating, to be honest, because I was like sharing to everyone. I didn't stay in that workplace for too long, but again, it's just that kind of, some organisations are great. NHS England, we've got a mashallah really good prayer space with good facilities as well. But again, if you work in a hospital, you might have that, but it's not always the case for everyone as well. So yeah, just to kind of point out some of the quotes here as well. And then in preparation for this session, like I said, I reached out to our members. And again, these are probably not surprising anyway, but I wanted to ask and have members have the opportunity to talk about some of the issues and challenges that they faced in the workplace. And we've heard a bit about the kind of microaggressions, and I think some of it, and the racism, and I think a lot of it has been compounded in the past year. So since the war in Palestine and Gaza, and some of the issues that's raised, and then the summer riots as well. That has really had a kind of really detrimental kind of impact as well. There was some research that the Muslim Women's Network, so separate to my network, kind of they did a survey in the summer following the riots, and what they found that public services like the NHS had like a really kind of impact on, and having that kind of racist experience from patients. We have a chaplain who's told us about some of the experiences that she's faced, and staff have told her about some of the issues. Saying the P word to a member of staff and saying, oh, that's short for Pakistani, so why should that be an issue? Being told that you smell like, and you don't smell like an Asian person because you're different, or you don't smell like curry, or being really surprised that they're basically has a Yorkshire accent and actually is from here. Other examples that they shared was staff being allowed to go for a smoking break but not for prayer break as well. And I know Ushna is going to cover some of this as well, but around kind of hijabs in theatres as well, and being told to remove the hijab and not being able to kind of go into surgery, but it really affected this person's confidence and felt targeted and isolated as well. I could go on. I think there's so many of these issues, but it was just, we hear a lot, and there's been lots of reports from the RHR talking about the systemic and structural racism. But again, I think it just really compounds for us as Muslim women working in the workplace as well. The next point I kind of touched on already as well, but is around that kind of limited progression into senior roles. So, it takes a long time for people to progress, and, for women as well, there is that issue, especially if you're on maternity leave, for example, that kind of having, but it's just that progression probably feels doubly longer. I'm probably been a bit kind of lived experience, but I've had so many instances where, I've had colleagues who started after me in teams, and I've seen that kind of career progression much more fast and more fast streamed as well. And then it makes you really think and paranoid, thinking, what am I doing wrong? But, when you go for interviews, you're nearly there, or you've just kind of made, there was someone who just pipped you to the post, and just the effect that has on someone's kind of confidence and mental well-being as well. And just not having enough role models as well. I think one of what our members have said is, they'd love to have mentoring from senior women, Muslim women as well. And that's been difficult because we just don't have enough of those role models as well. And then kind of working in organizations, what members have said is they're working in places where, do people actually want to listen? Sometimes it's quite tokenistic. Oh, we'll do a session on Islamophobia awareness, but actually, are they listening? And then when they're raising some of the issues, actually, are they being listened to? And what some members have found is that when they do actually raise some of the issues, they're actually treated really detrimentally when speaking up. And they basically feel like they're kind of forced, managed kind of out of the organization, and that really has an impact. There's a member who's actually basically, speaking up has had such a detrimental effect on her well-being, and to the point that she actually felt suicidal, because she's just been off with stress and on sick leave, and it's just had such an impact, because what she's found is the regulators, for example, probably are not listening either, or they've got regulators in and not really listening. And it's like I said, when what happens in the end, these women end up leaving the service, and then you have even more limited kind of people in the organization. We have really capable women in these spaces, and then for them to feel that they're being de-skilled, and then their own experiences of kind of not just working in NHS, but being women who's accessing services and really having poor experiences. You hear a lot about kind of maternity services as well, the impact that has, as not being listened to, or not the baby syndrome, and not really being cared for as well. So it's not just about kind of working in the NHS, but actually being actually part of the service as well. I just wanted to also share this. I don't know if you can see it, but hopefully you can see it well enough on the screen. But this graphic, it really resonates with our members. It's so many people have said this has happened to me, and it's happened to me personally as well. You get a role, and it's celebrated. Oh, look, we've managed to recruit someone, a woman of color, a hire, and then you have that honeymoon period where you're celebrated and you're welcomed and you're kind of put out, and it's almost like the leadership are patting themselves on the back. Kind of, look what I can do. We've got diversity, we've got women of color, we've got a hijab, woman. Aren't we really great? And then what happens? What happens is the woman of color points out some of the issues, talking about some of their kind of, do they have good EDI practices in their recruitment, and really kind of pushes for accountability. And then what happens? The organization doesn't really listen. And then instead of fixing the problem, what happens? The issue is basically being told, oh, maybe you're not good enough. Maybe you're the one who's at the, who's got the problem, who's the issue. And then that woman of color will then end up leaving that organization, and who is that benefiting? So when we share this on our WhatsApp group a few times, and every time I see it, it's like we have so many people saying, yeah, this has happened to me, this is my lived experience, and it is really sad to kind of see this. Now moving on to kind of overcoming some of these challenges. Like I said, I don't think any of these challenges are new to anyone. I think everyone will probably kind of aware or experience some of those challenges, sadly. But what can we do to overcome some of these challenges? Let's kind of really think about the positives. Having sessions like this, or in your workplace, to really share your experience and provide insights. I know there's pros and cons about this, because it shouldn't always be the responsibility on the person, on the Muslim woman, to kind of share this, but you have to maybe start somewhere. So an example that I can provide, and I know members of my network have done this as well, so it's not just me, is when it's Ramadan, actually holding sessions about Ramadan within the team, because people are interested. And like I said, I'm more than happy to share if there's that kind of curiosity, but that intention is coming from a good place. And mashallah, now I think there's probably lots more in the supermarket, for example. So you see the Ramadan offers that, it's not just for Muslim people, it's for kind of, it's available in the mainstream supermarkets as well. But having those sessions, taking, food in for Eid, and celebrating kind of in your workplace. And I know that's not always possible, but really creating opportunities to share insights and, share these experiences as well. I think what people have said, that goes away to kind of really opening up that dialogue and having those changes being made as well. Again, some of our members, and I've done this myself as well, is kind of, developed and organized training, or asked other people to come in to kind of have sessions, you know, about microaggressions and talking about race and having that anti-racist training. NHS England do that for their staff, and I guest speaker on that as well, talk about microaggressions. But really having those sessions that people are available, and it's for everyone to attend. It's not just a kind of same people attending that as well, and having those kind of policies available as well. Celebrating achievements, I've said this kind of before, if people are not going to celebrate us, then we need to celebrate us as well. So really kind of showcase. I know that's really difficult because it's kind of like we like to be modest, or we don't want to be, it's about the pride, and you know, as Muslims we really think about that. But I think for us, you know, if someone does win an award or someone gets a new job, you know, we will kind of showcase that, and I think the more we do that, the more that people will sit up and take notice as well. Then allyship and support. I've been quite lucky in terms of the network. We've had a lot of support from senior leaders, people like Sam Allen and John from NHS Confederation and a few other organisations who've been really supportive and created that space for us to speak. And our members have said similar, having a supportive line manager and having a team who actually listens makes such a difference. And that makes people want to stay in the organisation. It helps that retention and recruitment as well. Not everyone's lucky to have that, but what our members have said is that really kind of helps with kind of making that workplace a nice place to stay. And then just having that commitment from the senior leaders, that top-down commitment, and with kind of leaders actually genuinely wanted to listen to the experiences, and then actually, okay, you've listened to it, what next? Are they actually going to do something about it? Are they going to share with their other senior leaders? Are they going to open up doors for people as well? So what we found, members have said that really helps. And what I've done in that box as well is I've shared the 4 A's that the MDA have done in a report, where they talked about kind of 4 areas of allyship as well. So I'll pop a link to that report, but I think they've had, you know, 12 action points as well, which has been really helpful as well. And just linked to that kind of top-down commitment is actually holding organisations to account. There's things in the res data, CQC role-led framework has information about kind of treating staff equitably, and, you know, using that. Actually, you know, so should it be down to us? Shouldn't be, but it probably is for us to kind of hold these leaders to account and asking, what are you doing? What is the organisation doing? You know, there was things around after the summer riots, as an example. We had members talking about, well, not everyone in the organisation spoke about when they put kind of statements out about the riots. They talked about racism and actually not about Islamophobia. And some, you know, and they wanted it to be called out because it was at the heart of that was Islamophobia. It wasn't just racism. Some organisations, NHS organisations, did this well, some didn't. Some changed their stance afterwards, and it's very similar to when the war in Gaza happened in October. We heard from members about that kind of lack of parity and one-sidedness in some of the messaging as well, about actually pushing back and, you know, using some of that information that's out there, using the data that's out there on the workplace. You know, there is information published about race, but is there always information published about faith in the res data as well? And pushing and asking. There's a massive drive at the moment called the NHS Change, part of a 10-year plan. How many of us have actually gone on to that and shared some of our ideas? This is an opportunity for us to come together and share some things that we think should change as part of the NHS. So, you know, using those opportunities as well. And then finally, I probably would say this being the chair of a network, but I think the power of networks and working collaboratively with other staff networks. I think, you know, like I said, we've worked with BIMA, it's been really great to work, but, you know, we've also worked with the National Muslim Network, the MDA, the NHS Confederation Health and Women Leaders Network, their BME Leadership Network as well, and kind of seeing what we can do together as well has been really important, and it's really helped us, especially because at the moment I'm the only chair at the moment, kind of setting up a leadership committee, but just being able to kind of work with other networks has been really helpful as well. So I'll pause there. I think that is the end of my slide, and I'll stop sharing now as well. Oh, last slide. And this is just if you wanted to join the network. Again, I'll put this in the chat. You just need to send us an email, and we can kind of add you to the network. And we'd love to have a kind of all of you kind of as part of a network as well. You don't need to join the WhatsApp group if you don't want to. I know it can get quite much in terms of the comms and stuff as well. But and if there are any allies on the call as well, more than happy to kind of add you to a list as well. We can share some kind of events and information as well. So Jazakallah khair.
Jazakallah khairan for sharing. it's always really interesting to hear about other networks, other organizations. So it's also focused on, tackling and dealing with issues related to Muslim women and Muslim women specifically within sort of the professional environment. And I think, it is sad that I think, unfortunately, a lot of the things that you were sharing about some of the challenges that Muslim women face, some of the microaggressions, racism, I think everyone within this call can relate to something within that. And that is sad. But I think it's also, a beautiful thing that we carry on sharing the successes that we do have and the achievements. So thank you so much for sharing everything the organization does. Let me just share my screen and we will move on. Can you see my screen here? Brilliant. So we'll be moving on to introducing our next speaker for today's event, Dr. Ushna Javed. So Ushna is an ophthalmology resident and is also currently the BIMA Dresscode's lead, and we'll be discussing uniform policy challenges within the workspace. I believe you guys recently presented your work at a conference, a national conference, and won a few prizes. So I think Ushna might be touching on that a little bit today, maybe. So having suffered some of her own issues with uniform policies, Ushna has learned some practical tips along the way that she will share with us today. So without further ado, I will let Ushna go on and share her screen.
Jazakallah khair for the introduction. I will just load my slides. Can you see my slides?
No, we can't see. Are you sharing all your screen?
Yeah, it did say there's an error, so 1 second, I'll just try again. Saying can't share your screen. Sorry, an error has occurred when screen sharing. Please try again.
Should I share from my screen? Because I do have your presentation. And then just let me know what you want to share when you want to carry on.
Sure. Thank you.
Can you see that?
Yes. So assalamu alaikum everybody. So Nazifa's already done most of the introduction, but like she said, I'm an ophthalmology trainee doctor, currently out of program for research based around the Bristol area, so the southwest of England. And I kind of got into this whole area just because I was having issues with it, and it led me to kind of look up the policies and work out how to advocate for myself, which took, to be honest, a long time. But it also kind of led me towards BIMA, and we've been doing a lot of work to kind of raise awareness and to try and influence change locally, regionally, and nationally now. So hopefully I'll be able to share a few pearls of wisdom, but also more excitingly share results from our recent projects that we've been doing. Yeah, I hope it will be something useful in that. So the plan for this presentation, it won't be more than sort of 10-15 minutes, is basically just discuss how uniform policies can cause issues for Muslim female healthcare professionals. I'll just go through the current guidance that's out there, and then we'll go through the results from our national audit and our national survey, and then tips to overcome the challenges at the end. So the three kind of main areas that I found that can be tricky are bare below elbow rules, so like a blanket policy that's applied to everyone, the prevention of hijabs in theatres, which can be an issue, and also, and I'm finding we're getting more queries in BIMA as well about this, is about niqabs and preventing niqabs in clinical areas. Again, this kind of varies trust to trust. So in some trusts, you may have no issues with any of this, and other trusts, you may have issues with some or all of these areas. So if you do have a phone with you, I would highly recommend you take this QR code, take a picture of it, and it will lead you to this uniform and workwear guidance for NHS employers. And this guidance, it basically is for NHS England. So if you're outside England, this doesn't directly apply, but a lot of the other nations kind of follow what England does anyway. So it is still useful to have. It basically outlines uniform policies guidance, and it also includes about provision of headscarves, niqabs, and about adjustments to bare below elbows. And the key thing to note is that this isn't just something that one hospital came up for, it's for NHS England, so all the trusts within England, guidance for them. It's not legislation, but it is guidance. And it was agreed upon by national committees like the Infection Prevention Society, the Healthcare Infection Society, the BMA, and I forgot to put the logos, but of course BIMA as well, and the Muslim Spiritual Care Council. So it's been vetted by all these organizations. I will show an infographic which will explain this guidance a bit more, but in terms of headscarves, your cloth headscarf is allowed in theatres. What they say is you should have a clean headscarf dedicated for theatres that you can wash at home at 60 degrees, but you can wear your cloth headscarf. You do not need a theatre cap on top. I know sometimes scrub nurses feel a bit better if you put the cap on top. You don't really need it. It just says you can or cannot, it's up to you. Orthopedic hoods and disposable headscarves are another option, but with orthopedic hoods, they need to be opaque and they need to cover your neck and chest fully in order to meet both requirements. I personally do not find them as a suitable alternative because they just don't fit the shape of my face and head, and if I wear them, you can still see my hair and my ears and my neck, so I have to wear a scarf underneath anyway. So it kind of depends what your situation is. Some people are happy with them, some aren't, but yeah, headscarves are allowed in theatres. And then this QR code will basically take you to the BIMA page about dress code, which shows the infographics. This is quite useful to kind of just illustrate to people within hospitals, like your theatre managers and scrub nurses and things, to show what kind of headscarf options are allowed. So again, it just says your cloth headscarf tucked in neatly is allowed, your orthopedic hood or disposable hijab. And the BIMA dress codes page, it also has a link to a BIMA modest wear catalogue, which is the second picture you can see there under disposable, and that basically links lots of providers where you can source these disposable headscarves and disposable like oversleeves, which we'll go into. Those are all available within the BIMA website. And just to note, with the disposable headscarves, these are something that are procured by the trust. So it's not something that you can really order, but the trust can kind of order in bulk. But they usually kind of arrive within a week or so. I just wanted to point out one of my colleague Azra's surgical scarf project as well. So this is a Royal College of Surgeons grassroots project, and I believe she's won an award for it as well recently. Someone posted in the BIMA group. But it's just showing that religious head coverings in theatres is not just the hijab, it can also be the Sikh turban, the Jewish kippah, and also non-religious things like Afro-Caribbean hair that may not fit in your traditional scrub caps. So it's about kind of valuing diversity and valuing our workforce and making everybody feel included. So if we move on to bare below elbow, so firstly, there is no evidence for bare below elbows. It took me a long time to work this out because I thought if this is a national policy, there must be a reason behind it. You know, it must prevent infection. But even the guidance, which I showed you the QR code for, it even says there's no conclusive evidence that uniforms or workwear play a direct role in spreading infection. It's actually washing hands that's most important. Bare below elbows was a governmental policy without much consultation introduced in 2008, and it was kind of, I guess, to firstly get rid of the white coats, and also, I guess, to kind of make people more able to wash their hands, I suppose, more incentive to wash their hands and ensure the wrists and everything are washed properly. But rolling your sleeves above your elbows itself does not prevent infection. It's making sure that you've washed your hands. That's the most important. So again, this is the same QR code to the other infographic page. It basically takes you to a kind of visual depiction of what the guidance says. So essentially, that national guidance in terms of bare below elbows, it firstly says you only need to be bare below elbow when you are in direct patient care activity. Direct patient care activity is when you are physically touching the patient, so direct care activity like examining them or doing a procedure on them, or you are in their bed space, so you're touching their bed. that is direct patient care activity. If you are just walking through the ward, you do not need to be bare below the elbows. If you are sat in the corner doing your discharge summaries, you don't need to be bare below the elbows. It's literally when you are touching the patient. In that case, if you are not happy to expose your forearms, you can wear these disposable oversleeves in the same way that you would wear disposable gloves. So you just slip them, you wash your hands, you slip them on, and then at the end of your direct patient care activity, you can take them off and throw them away. Again, in the modest wear catalogue that I showed you earlier, they also have links to where you can get these disposable oversleeves. And again, the trust can procure them, or you yourself could get a box of them as well, whichever. But like I said, so you have options. You don't need to expose your forearms if you're not comfortable with that. And then lastly, just to mention about what the guidance is regarding niqabs, there's actually not much guidance about niqabs in the guidance, and this is something that BIMA are hoping to develop some guidance on in the next year or so. What it says at the moment is that headwear and veils, so Christian or niqab, are permitted on religious ground, but then it also says provided that patient care, health and safety, infection control, security, etc. is not compromised. And what this kind of means is that there's no outright ban on the niqab, but it kind of requires more of a in-person discussion with your supervisor or line manager, depending on your role. And it kind of just depends on your trust. So some trusts are quite accommodating, and other trusts, they might be a bit stricter on it. But unfortunately, there's no more detailed guidance about it at the moment, but it is something that we hope to develop. So what I'm going to do now is just go through some of the results. So what we've been up to this year as part of the dress codes team in BIMA Women's. So we conducted a national audit of every uniform policy within NHS England. So that included all the acute hospitals, community hospitals, mental health trusts, and also the ambulance trusts. So there was 211 trusts that we contacted, and we received 200 of the uniform policies, so with a 95% success rate. And Amina will testify a laborious process. We triple checked all of these uniform policies, and I've just simplified some of the results. They're still being analysed, but we looked at how many of those hospital or just trusts had a provision for religious head coverings in their uniform policy. So 62% had no provision, so they had no mention of headscarf, which is an issue if you, like myself, try and go into theatre and the scrub nurse stops you because it's not in the uniform policy. That's an issue. 8% allowed an orthopedic hood or a disposable hijab, but not your own headscarf. And only 30% mentioned that you could wear your own religious head covering in theatres. If we move on to bare below the elbows, so 48% of hospitals said everyone must be bare below elbows as soon as they enter the ward, type of thing. There are no adjustment. Everyone must be bare below elbows. Again, only 30% said they had the option of the full sleeves when you're not in direct patient care activity, and the option of disposable oversleeves when you are in direct patient care activity. 10% only had the option of full sleeves. They didn't allow disposable oversleeves. And 12% only allowed disposable oversleeves, but not the full sleeves. So basically one or the other, but not the full kind of what the national guidance has suggested. So yeah, this is something that we are analysing more kind of per regional variations within England. But from kind of just eyeballing it, it seems to be across the country. There's issues everywhere. It's not like one area is just very good at this. But we will hopefully have some more detailed results in the coming year, which we hope to publish. In terms of niqabs, only 12 out of the 200 allowed them, so 6% explicitly mentioned that you can wear a niqab when doing your clinical activities. And moving on to the survey, so we also conducted an online survey for 1 month between the end of August and end of September. And this was open to all Muslim female healthcare professionals or healthcare students in NHS England since April 2020. And that date was chosen because that's when that national uniform guidance was published. This survey was advertised through the BIMA annual conference at the end of August, and also the BIMA social media and WhatsApp networks. We kind of went through all of these themes about sort of headscarves, bare below elbows, raising concerns, mental health, and knowledge of the uniform policy, and I'll go through each of them briefly in turn. So overall, we received 430 responses. It was a mix of professionals, mostly doctors, 35%, closely followed by medical and dental students, nurses, dentists, and other allied healthcare professionals. Majority of the respondents were under 34 years of age, and the majority were Asian or Asian British, but there were other ethnicities as well. So one of the questions was, have you ever been prevented from wearing your headscarf in theatres? And 27% of respondents said yes, they had been prevented. We also had the option of people leaving the comments, and I've just chosen a few of them to share with you. So there's sort of common themes like I was made to feel intimidated, and saying either you take your hijab off or you don't enter theatre, being not allowed in theatre and being sent to another placement instead. People left feeling quite anxious and feeling quite bullied, told to take that thing off the head. And this common theme of people saying, well, it was a big part of my identity, so I didn't want to remove it, and instead I just avoided theatre. And that's such a shame, because there's capable people who could be excellent surgeons serving the community, but they've just had that opportunity taken from them, unfortunately. And just a few more kind of like people trying to raise concerns, but they were just dismissed because they felt they were perceived as hostile, and having to escalate it to people like the training program directors or their consultants, and being made to feel like a nuisance. When asked, have you been asked to be bare below elbows when not engaged in direct patient care activity? So this is when you don't need to be bare below the elbows. And 72% said yes, they had, which is, I'd say, surprising, but I think we've all been there. So. And I'm sorry, I don't know what has happened with the slide with the writing, but we also asked, have you ever felt you had to comply by being bare below the elbow? So you didn't want to be, you didn't have to be, but did you feel you had to roll up your sleeves? And 62% said very much, and another 24% said somewhat, and only 14% not really and not at all. Again, some quotes from the bare below elbow questions, and people saying, for them it's just a small issue and they don't really understand it, but for me it's a big deal, and I just comply as I don't know how to express how I feel. And then some kind of quite upsetting stories about being humiliated, like being called out in front of everyone by the ward managers or nurses, and this person saying she shouted at me, and on the third time I burst out crying. Again, people feeling like they'd been harassed or being told to leave the ward if they're not rolling up their sleeves. And also someone raising that there's actually a barrier to asking for the sleeves in the first place because they're just not available. Or other people saying you don't know where to store them. Like, do you put them in your pockets? Like, if you're going from ward to ward, what are you supposed to do if they're not available in every ward? Like, that's another barrier to actually using them. We also asked, have you felt that you've been treated differently at work because of your trust uniform policy? And do you feel you've been treated differently at work because of your faith? And both of these questions, about a third said that they had, and the rest said that they hadn't, not really. We also asked, have you felt that your uniform policy has affected your mental health? And 18% said very much, and another 28% said somewhat. The rest said not really. And for those that it did affect their mental health, they're asked, in what way do you feel it has affected your mental health? And I'm sorry, I don't know what's happened with the slides, but majority of them said it led to feelings of alienation, and it was closely followed by caused stress and anxiety, and then led to low mood and affected performance at work. And then some people left some other comments, which I'll share with you now. So one of the, like I mentioned, common theme was this kind of difficult reconciling faith, which is so dear to me, and then the profession that I've always dreamed of entering into, that kind of constant battle of you don't want to let your face down, but you don't want to let, be not seen as a professional, and how do you kind of balance the two together, and the whole kind of identity and modesty being part of your identity. And people mentioning, it's very stressful. It's already stressful dealing with wards and on calls and your clinical commitments, and then having to deal with this on top of that is just incredibly stressful, and feeling of not belonging. We also asked, have you ever considered changing job roles because of your hospital uniform policy, or have you even considered leaving the NHS? And again, a third of respondents for both those questions said they had considered it, and 2/3 said not really. We also asked, do you feel comfortable raising concerns about uniform policy with your supervisor or line manager? And about a third said they were comfortable, and 2/3 said they weren't comfortable. And at the end, we asked about if the respondents were aware of this national guidance that was out there that kind of lays out what the current adjustments are available for Muslim healthcare professionals. And only 15% said that they had read it. 32% said they knew of it, but they hadn't read it, and 53% were unaware that this existed. So this kind of highlighted quite a major gap in awareness of this guidance. So overall, from this kind of preliminary analysis, we can see that uniform policies continue to negatively impact Muslim female healthcare professionals. And for some, these issues are severe enough that it affects their mental health and it can affect their career choices. And there seems to be a lack of awareness of this national guidance amongst Muslim women, as well as obviously the other general public. And this should not be the case. So what can we do to make a positive change? So the first one, I think, is educate ourselves. Like, I mean, how can we advocate for ourselves if we don't know what the guidance is? I mean, you can't expect your scrub nurse and your manager to be up to date on religious adjustments if you yourself are not aware of them. So the first thing is to educate our own selves, to know what our rights are, to know what we can ask for, what adjustments we can ask for, to stand up for ourselves. The national guidance is in our favor. It does allow headscarves in theatres. It does allow adjustments to bare below elbows. And that is agreed upon by national infection prevention control societies. So when the infection prevention nurses kind of raise it to you, you can say, well, your national lead has said it's okay. So, you know. Additionally, the Equality Act, it states that organizations have to make reasonable adjustments for people with protected characteristics. So all of these are reasonable adjustments in the national guidance. The next point is, I would say, is don't take no for an answer. And that's again from my own experience. You know, the first door that you knock on, it might be a no, but you have to keep going until you get a yes. So you have to kind of push for what you want. If you feel like, you know, people are not listening, they're just turning you down, or, you know, you're being perceived as a nuisance person, and you need kind of some other backing, someone to take you seriously, you can contact us, you can contact BIMA. We've done this for quite a few people now since I've been there. You know, people have contacted us and we've then contacted their organization, their trust on their behalf, and just kind of held them to account. Like, you know, this is a national guidance, it's being used in many hospitals. Why are you discriminating against this person? And every time that we've done it so far, they've changed their guidance, alhamdulillah. So if you are having issues with uniform guidance right now and you joined this call and you're wondering, well, what can I do? Well, the first thing is look up your uniform guidance. You can find it on your trust intranet. If you can't find it, email us. We have a database of 200 now. We can send it to you. And just look at what it says. Like, does it match the national guidance? If it does, then your issue is solved. You know, if whoever's causing you trouble, you can send them your guidance and say, well, you know, it's in there, I can wear my sleeves or I can wear my headscarf, and that should hopefully be resolved. If your hospital guidance is not up to date, if it doesn't allow these adjustments, which is usually the case if you're having issues, so the first thing would be to contact your supervisor or line manager, the hospital EDI lead, so the Equality, Diversity, Inclusion lead, and your infection prevention and control team, which is sometimes the acute infection care team, or they're called the IPC, infection prevention control team, and send them the national guidance and say, well, this is a national guidance, it allows this, but our local guidance is not up to date. Would you mind please updating it? And I will be wearing my headscarf as per the national guidance, or I will be getting these disposable oversleeves. By the way, here's the modest wear catalogue linked, where you can procure them for me and other Muslims in the hospital. If they are not taking it seriously, or they're kind of saying, oh, it's an infection prevention issue, you can say, well, the guidance was agreed upon nationally by Infection Prevention Control, And if they're still not happy about it, you can contact us and we can kind of send them firm emails. And we're working with IPC teams nationally as well, so we can kind of link them in as well and contact them on your behalf and hold them to account. So what's BIMA doing about it? So like I said, we answer queries on a weekly basis from different sisters across the UK, not just England, and try and help support them on an individual basis with issues that they're having. Sometimes it's just that kind of support and confidence to say, yes, you are in the right, or this is kind of what the guidance is, and push forwards with it. So, most of the time, we've not had to get personally involved. We've literally just given them the confidence and made them aware of the guidance, and they've been able to push through with it themselves. But like I said, some others we've had to contact the organizations as well. We've been trying to data gather this year to kind of prove our point that it is an issue and how it's affecting Muslim ladies. So that's something that we are now analyzing and disseminating at different meetings, and trying to get a paper published from it as well, so then we can disseminate that further. And our aim is to essentially change as many uniform policies as possible over the coming year, and also to update that national guidance to be a bit clearer about niqabs as well, and be a bit easier to read for other professionals. If you want to be involved with this dress codes work, or the women's team, or BIMA, or have any suggestions of how we can do better, or any other ways we can help, then these are the email addresses. So women@britishima.org is where myself, Nazifa, and Amina are based, and info@britishima.org will take you to the wider BIMA organization. Like if you want to become a member, or any other suggestions for BIMA, feel free to email us and we would be happy to help. And again, sorry about the slides. I think it's because I emailed them across. But yeah, it's up. Open it up to you guys. Any questions or any queries, and please let us know.
Jazakallah khairan for that. Can you guys hear me? I just forgot if I muted myself or not. Sorry. Jazakallah khairan for that. That was incredible. Thank you so much for sharing all of that. I'm going to go to bed tonight thinking about that bare below the elbow situation. That really shocked me. I was like, oh, wow. Because I think of everything, that one definitely, I think everyone would have heard about sort of the issue regarding bare below the elbows, and the fact that that's actually not even based necessarily on any scientific evidence that suggests it improves, or reduces infection rates and all that kind of jazz. It's quite mental. So thank you for sharing that.
Yes, no problem.
Let's open it up then. Actually, before we open it up to Q&As, Amina, I think we wanted to first just talk about the British Islamic Women's Network first. So I'm going to hand it over to Amina to talk a little bit about this network that the BIMA organization are opening up. And yeah, if you'd like to go ahead.
Yeah, Jazakallah khair, assalamu alaikum. Yeah, I'm amazed by both presentations as well. Jazakallah khair, both of you. I've learned a lot today, and I just feel like I feel empowered by today, that there is a lot to do, inshallah. But after today, you're probably wondering, what do I do? What sort of support is there for all of us? We at BIMA have a women's network. It may be new for some of you guys, so inshallah, just log on or just take a picture of that email address. We'll share it out later as well. If you're interested in joining the BIMA Women's Network, where we continue the conversation and be that support network for healthcare professional women, just join the network, and inshallah we'll continue the conversation, not start the conversation, and be the support network for you. If you are part of, say, Sabina's network, no harm in being part of both. I think we're all going to be tackling the more the better in some ways. So yeah, inshallah, just spread the word as well. Jazakallah khair.
Thank you. So let's open up now onto the Q&As. I'm sure there will be some questions. Are you okay with just checking the chat? Because if I switch around, you'll see the camera just goes weird. Please feel free, guys, to share any questions that you may have. I certainly feel very inspired by everything that was discussed today. If there aren't any, oh, there's a question about you, Mom.
Shall I take this one? I think dress codes. So there's a question, if I was a doctor, is it possible for me to never have to roll up my sleeves even when dealing with patients because I could wear disposable sleeves? So essentially with the guidance, yes, that's true, because what you'd have to do is when you're not dealing with patients, you just have the sleeves roll down. So cover your arms covered. And if you're going to go examine a patient, you would just wash your hands. So you just expose your hands, not the whole sleeve, wash your hands. And then you could just put your sleeves on, examine the patient, and then take them off and throw them away. The only time I would think that you might end up exposing, and then again you could probably ask, the only time I was thinking was if you're, for example, scrubbing up in theatre, because you have to scrub up all the way to your elbows in theatre. If there was a male like consultant or someone who's scrubbing up at the same time, but you could just ask, can I just scrub up separately because I don't want to expose my forearms, and I'm sure they would understand if you explained it nicely. But yeah, essentially you don't need to expose your arms.
I think Pfizer's got a good question. So how can we join a BIMA association in our local area to be part of the team as a volunteer? I don't know if you want to answer that question.
You can answer it. You went through the process.
Yeah, so I mean, essentially when I joined, it would have been, I think, around 2 years ago. I Googled BIMA, and there was and I think they had a there was a they were in the recruitment phase, and I essentially signed up. It was a Google form. You filled in a few questions and you wrote down what was the teams that you would like to join, and I put BIMA Women's as number one. And then, alhamdulillah, I got in. So it's a very short form. I think if you don't, so that's part of the volunteer. Like if you want to volunteer as part of the BIMA's women's team group, and there's also a bunch of other teams as well you could join if you were interested in it. And I think we are opening up our recruitment in a few months' time, I want to say.
Mm-hmm.
I think I'm correct in thinking that, yeah. So and then within our BIMA's women's team, for example, we're all across the UK. And so I don't know, we don't necessarily have like a local BIMA women's area, like say, for example, based in London or different areas across the UK. I love how I just focused on London there, but there are people who live outside of London for sure. But yeah, it would be just joining the team overall. I hope that answered your question. And then Iman asked, was there anything that any of you had issues with in particular when going through medical school in terms of hijab and mixing with male colleagues in work projects and things?
So I went to Birmingham. So alhamdulillah, it was fine. There was only one instance in Solihull Hospital. I remember a scrub nurse did not want me to go in with sleeves or headscarf. I can't remember which one now, but she was just not happy with me being there. But the consultant was like, "Come with me," and she just gave me sort of looks the whole time. But it was fine. I still went in. But yeah, otherwise, I didn't really have much issues in Birmingham med school. And in terms of mixing with male colleagues in work projects and things, I think like if you're obviously allocated in a mixed group, like you have small group teaching and things, and you're usually mixed, then you just do that as professionally as you can, type of thing. So it wasn't really an issue. And if you got to choose your groups, then obviously you choose them, and like you can choose who to sit with in lectures or who to buddy up with in clinical placements and that type of thing. So personally, I didn't have other issues during med school. It was afterwards.
I think that's one thing, a very common theme across both your talk, Ushna, and Sabina, is the importance of leadership and having those people within those, I guess, higher positions and whatnot to kind of pull everyone through. Because, for example, Ushna, you were mentioning how a lot of situations where people struggled with dressing modesty in certain situations, where it was the consultant or the supervisor who had to step in and get involved in order to help out. but I suppose the question is when, if that supervisor or that consultant isn't very helpful, where do you go then? And I suppose that's when you can get in contact with our team or even the NHS Muslim Network team, for example. So yeah, that's very interesting to note.
Yeah, just to add to that as well, I think even like having to shake hands when you're in the office and stuff as well. Have to say, kind of one of the positives of pandemic was like not having to like shake hands, and you kind of say, you know, being able to step back and stuff. And what I found kind of going back in the office, that kind of culture has kind of moved away now. You don't always get the having to hold your hand out and stuff. I remember when I was at CQC, they had colleagues from I think UAE, and you know what they would do is someone would shake their hand, they'd put their hand kind of like this against them as like a way, instead of shaking their hands. And I thought that's really great. And I think even King Charles has done that when he's seen kind of Muslim like women as well. I wish we could bring that kind of into like working culture as well, but that kind of having to step back when not wanting to offend anyone, but shaking hands in that kind of work culture as well, and not being made to feel difficult about it. So I'd love there to be kind of awareness raised about that, you know, just, and actually someone, you know, I have had probably just one or two people in like non-Muslims who ask questions about that, but like I said, there isn't that kind of awareness about some of that as well.
I think Faiza asked, do we have any WhatsApp groups? So we do have, there's a BIMA Volunteers WhatsApp group, which you would get added onto to join as a volunteer. And then also now we've got the launch of our Muslims Network as well, which this was the email for that. And then also we'll share, Sabina, your link as well to join the NHS Muslims Network as well, their WhatsApp group. So there are a few groups you can definitely join. Nazreen asked, is BIMA just for medical staff? I'm an NHS manager managing a tobacco treatment service in an acute trust. So definitely BIMA is not just for medical staff. So I think often people think it's just for doctors, but it's definitely not. Amina, she is a pharmacist, and we have people as well from other allied health professions. So you don't need to be part of like purely within the medical area or staff. Yeah. Thank you, Sabina, for sharing the Muslims Network email to join. And Salima, thank you for walaikum assalam. Thank you for sharing the changes that have been made in East Lancashire. That's brilliant. That actually, that's the thing with a lot of these things. Once the trust, I feel like when you talk about these situations, they think it's just for Muslim people, but actually, when you start implementing, like if people start buying things like disposable sleeves and even the surgical caps, everyone starts using them, or you'll find that there will be people that you think wouldn't need it, but actually find it quite useful to use. So yeah, no, I'm happy that that's happened in East Lancashire.
Can I just ask, Salima, with the disposable oversleeves, do they have them available sort of like gloves at every ward, or how do they provide them for the Muslim females? I'm just asking because I've had a few people email about how different places do it.
So at the moment, we've not sorted that out. We're in the process of setting up like a Dania area, but they are available on wards if you do need them, and they know where to go to. I have seen ward clerks wear them, and the policy was actually signed and in progress, but the person who was in charge of the policy left to go to another trust, so it's reopened again. So that's why it's gone back on the back burner, and we were having to rehash the whole thing all over again. But it was actually set in policy, and it was more or less done and dusted. So we're looking at workwear uniform as well. So some people don't want to wear tights; they want to wear a long tunic and pants, long sleeve tops underneath as well, and things like that. That's what we're looking at, and it's more about. The trust has agreed, actually. It's just about where we can finance it from and how we're going to do it. So that's where we're at, really.
Amazing. Jazakallah khair for sharing.
I should ask, in terms of an interview for a job role, do you mention that you are required to pray 5 times a day, and ask whether the hospital accommodates to that?
I think Nazreen added something as well, and I personally wouldn't kind of mention that before. I mean, if I was working in a hospital, I'd probably maybe just check on their website to see whether they have a multi-faith room. So, you know, I've never personally asked that in an interview, but kind of look into that kind of afterwards. Maybe that isn't a good thing, but I'll be honest, I think sometimes it's the challenges of actually securing a job and all the other challenges. I probably wouldn't even raise my flexibility issues kind of before an interview as well, when kind of what I you know, in terms of, you know, in Ramadan as an example, I work from home and do half days and use up my leave. It's always been accommodated. But I would ask that once I was offered the job, so I wouldn't take a job unless I had that agreement, but I probably wouldn't ask that at interview stage. But everyone is different, so I wouldn't say there's a right or wrong way. But I think it is that kind of, you know, asking those questions before you take the role. But I think just because of, I mean, unconscious bias, you know, people would say we've been equitable in interviews and there isn't any bias, but unfortunately a lot of us know that does actually play into it. But would I take a role if they didn't offer me that? Then I probably wouldn't, to be honest, but would ask that at kind of a later stage rather than that interview.
I don't think there was any more questions. I had just a little question, if I could ask. I'm just wondering, from both of your guys' perspective, have you noticed any changes in terms of the responses, I suppose, from higher up organizations, or I guess people further up the ladder, in terms of how open they are to some of the challenges that you guys express and some of the concerns for Muslim women? Because I'm just thinking, have attitudes in any way shifted or changed since COVID, since, you know, everything that's happened in the world, all of the riots, all of, you know, the problems that have occurred over the past, you know, 4 years or so? Have you noticed any shift in attitudes?
I would say, you know, there's probably a lot more awareness now than there used to be. You know, like I said, you know, I don't think we're there yet. So as an example, there's a lot more Islamophobia awareness month sessions taking place this month. But we actually did have members saying, actually, our organization hasn't done anything, or, you know, they might not celebrate it in the way that they do kind of other events as well. But I have seen an increase and for better. And, you know, like I said, shouldn't always be our job. But, you know, I probably, you know, back in the days in my previous role, the chief exec would send in a weekly email. And I took it upon myself to email him to say, actually, Ramadan's around the corner, could you mention it? And he was actually responded back and actually did put it in his newsletter. And then off the back of that led to me being asked about doing something on the internet about Ramadan, and, you know, then about Eid as well. And when I went for Hajj, I was open and said about Hajj. A lot of people didn't know about Hajj. So then I was asked as part of Black History Month to do a webinar on Hajj, and, you know, used a lot of my pictures to share the experiences. Because, to be honest, a lot of the kind of connotations that people have is kind of in the media, right? That's what they think a Muslim person is like. I would have conversations with my kids, and it probably isn't the right thing to say. When we're out in the world, we're representing Muslims, and if people see you and how you behave, they're gonna like that. You might be representation, and again, that's really hard to put on someone, but it is the way the world is. You know, people might not have kind of be in part of a country where there aren't many Muslims or visibly Muslim people, and, you know, it's kind of work is a space, especially when I work in a national organization. So, you know, a lot of my colleagues are spread across the country. If I am the only Muslim person that they kind of have contact with, is kind of, you know, sharing. And sometimes I do feel like I'm probably going on about something, such an issue, and they're probably getting sick of me. But then I'll actually have colleagues say, no, don't stop. We really appreciate you and the passion that you have, and actually sharing and going, you know, sharing things and kind of making a point and a stance. Especially with kind of the work of my network, because all of it is done in my own time, as I'm sure with BIMA as well. Don't get paid for it. It's all voluntary work as well. And, you know, I had an email from someone who's asked me to do a session for the ambulance sector. Like, do you even sleep at night? You know, and sometimes it is challenging, but then you realize it's that raising awareness. And then what happens, some of us become allies, and then they share some of our work, and then they spread that, and then it's that bit by bit. You know, the theme for Islamophobia Awareness Month this year is like seeds of change, like small action that leads to kind of big change. So it's kind of doing our bit, but if you can kind of get off the back of that a support, you know, from allies, then they share and spread that, you know, then, you know, inshallah, you're making some changes and changing people's like misconceptions about Muslims as well, inshallah.
Yeah, I agree with that. I think it is that kind of, if you have any platform or any way of sort of making awareness, I suppose every little bit helps. And sometimes you don't kind of realize to what extent either. But I guess in terms of the dress code stuff, I think there is more awareness, and I think there is more push for change as well. I don't know if it's kind of my own personal experience, but I've also found if you raise it up to higher up levels of, I guess, the hierarchy and things, people are actually a bit more diplomatic and a bit more responsive. Whereas people like your immediate, you know, theatre manager might not be as accommodating. But if you raise it kind of above her boss's boss, you're more likely to get somewhere, especially if you kind of have the evidence to back you up. I guess a recent example was last year we presented at some of our findings at the Women in Vision conference, which was basically anyone related to kind of ophthalmology or vision sciences, like optometrists, orthoptists, and anyone in kind of allied vision health sciences. And I didn't realize, but one of the attendees was an ophthalmologist who is actually the head of the GMC and also head of all the Royal Colleges, affiliate head of colleges, and previous like president of the Royal College of Ophthalmologists. I didn't know that. I did not read the program and I didn't really realize who she was. But she was very positive about the presentation we gave and was like, oh, this is an issue. And I'm going to take it up with my GMC team to get this uniform stuff added to doctors' e-learning, for example, or staff e-learning that, you know, mandated by every hospital trust. Or especially, I pointed out, for example, in Northern Ireland, the issue was that a lot of the staff coming in who were Muslim background were also from other countries, so they were on a visa basis. They didn't know the rules of this country, and they were on a visa, so they didn't want to say anything that jeopardizes their job or jeopardizes their visa, so they were just kind of complying with whatever they were telling them. She said, this is literally just in the works. I hope it will go ahead, but also to introduce this in international medical graduate inductions, so they're aware of what the guidance is and what their like rights are as well. And that was obviously someone who's quite high up, and I didn't realize she was in the audience. But it's just the way things work out. So I think, yeah, people higher up, I think if you want change, you kind of do have to go higher up, and you might think, oh, you know, I don't know them, I don't have any influence, I'm a nobody. I have that all the time, you know, imposter syndrome. But sometimes they're just not aware of it unless you get it out there, you give them evidence, reason to change, and be a bit pushy. So you have to kind of keep going. It won't happen. So instead of just bashing your head with the same theatre manager, go above her. I think I personally would say that's the way.
I love that. Thank you for sharing, both of you. Do we have time for one more question, to answer one more question? It was just by Sana, who asked, any advice for trainees on finding mentors? Found it quite difficult so far. And thank you, Nazreen, for responding to that.
Yeah, I mean, we do find it quite difficult. We have tried kind of, like I said, setting up, we had a pilot kind of coaching scheme, and we do find mentors. What we've done as part of our network is we've got this kind of like database where people can input kind of their details and information, and if they're up for kind of willing to be a mentor or a coach, and then all members have access to that, and then they can kind of contact people directly. Or like Nazreen said in the chat, is just actually put that in the WhatsApp group and ask, and then, like I said, inshallah, people go forward. And if it's, like I said, I've had before like a student radiographer, and they wanted, and I've just been the conduit, because I have the membership files, is actually reach out to radiographers that I know, you know, because like I said, not everyone's on a WhatsApp group, to say, could you, you know, would you be willing to kind of be a mentor? So trying to really kind of initiate kind of that kind of contact and networking between people. Again, it's, you know, it's a very informal way, you know, there isn't probably formal way, but it's about kind of making that space ourselves sometimes when there isn't anything formal out there.
I think also, I haven't tried this, but I know BIMA have different groups per profession and also location. So for example, they have like an ophthalmology group, which I haven't joined actually, but I'm pretty sure they have a GP group and like other different like I imagine they have a pharmacist group. Yeah, they have like different professional groups, and they also have different location groups. That like there must be because I was in the breakout room with someone. There must be something like the Midlands group or North Midlands group or London group and that type of thing. So from there, I think you'd be able to connect with other people and ask them for advice and that type of thing. There probably is a midwives group, but I don't know for definite. I don't know if Amina knows more if there is. And then from your own like societies, like for example, that Women in Vision one that I went to, they have a mentorship scheme. It's not obviously for Muslims, it's for anyone, but that was specifically for women to find other female mentors type of thing. So I think within each professional area, there probably are other mentorship groups, but they wouldn't be specific to Muslims.
Brilliant. I think that's all the questions we have for now. Jazakallah khairan for everyone for attending today's webinar, and of course to our speakers. You both have been very inspiring, and I'm sure everyone has come away from this webinar having learned something and feeling inspired to want to carry on working hard and to overcome some of the challenges that we face. And inshallah, we will see everyone who's attended the webinar again. And you guys can please stay in touch with us. We've got our email, we shared our email as well with, and Sabina's kindly shared her email for the NHS Muslims Network as well on the chat. Please do follow us on our social media. And very importantly, please do fill our post-webinar survey. We, inshallah, are always striving to do better and improve and to think about what other events would be helpful to our members. So if there's any ideas that you have, please do share them with us. If there's anything we think you think we could improve on when it comes to these webinars, again, please do share that with us. And looking forward to everyone's feedback. Jazakallah khairan. And that's it from me. Amna, I don't know if you'd like to say anything else, but yeah, other than that, assalamu alaikum. Thank you, everyone. Have a good night.